Welcome to this EFIC COVID-19 webinar to hear the patient's perspective. My name is Joop van Griensven and I'm the President of Pain Alliance Europe. Pain Alliance Europe is a non-profit pan-European organization based in Brussels, Belgium, functioning as an umbrella organization of 44 national and regional associations in 19 European countries concerned with chronic pain, regardless of any underlying condition. On their turn, our members represent over 450,000 individual chronic pain patients. Quality of life, according to Pain Alliance Europe, is giving the individual person with chronic pain the options to live his life according to his wishes and his possibilities. And that's the reason why we're providing this info to you. I would like to share with you the first results of our COVID-19 survey done recently. These first results were presented to us on June 19, and we presented them to our members on June 24 during our virtual General Assembly. This slide shows the acknowledgements to all who helped us making this survey to a success. It was worth mentioning that we were able to get the survey translated by volunteers into 14 different languages, ensuring that as much as possible patients were able to fill this out. Considering the short period the survey ran, we can proudly say that we did reach out to 12 countries which provided a reasonable response and another 7 who provided a good indication. With an overall response of 1,565, we can provide some reliable figures, especially when you consider the replies came from a wide range of chronic pain patients. The overall impact on chronic pain patients' life is that the situation is a little worse as before. Mood, pain intensity and pain interference. Coping with the situation was a bit more difficult. Most patients feel they were more at risk and they are worried about loved ones or themselves getting infected. The uncertainty of the situation was also a big worry, as was the lack of seeing family and friends. They didn't worry to come to a doctor's office. And what is not mentioned here is that 53% was living in isolation, or by choice, or by governmental restrictions. The health behavior impact. A vast majority wasn't worried about taking prescribed medication, although 15% reported worries about that. And 29% of who had a self-management plan were not able to continue, which was 14% of the total response. However, what the most worrying is from this slide is the fact that 14% were not able to speak with someone about their mental problems or their worries. And that is 1 out of 7 patients. The scheduled impact on appointments. 20% didn't have an appointment, and from the other, most of them were changed in a phone call, cancelled or rescheduled. Only 7% had a video call. Appointment cancelled by patients was rarely, and most of them being afraid to get to the hospital, and 7% didn't want to bother the healthcare professional. What was really worrying is the fact that patients stated that they didn't receive adequate information from the whole scale, government, healthcare professionals, patient associations. And this is reason for all of us to look carefully to the future, what we can do to improve this in situations like this. Where patients needs most help with was their pain treatment, healthcare questions, and coping with fears and worries. And we would like to thank everyone again who helped us with this survey, and we are going to work hard to make a full report out of the answers, which will become available through the website of Pain Alliance. And thank you for listening.